We treat a lot of people with diabetes in our office because diabetes is one of the most common situations and seems to be increasing every year. We also treat something called pre-diabetes, which is when a person has an elevated blood sugar but not high enough to be classified as diabetes yet. But those folks are moving in that direction, and usually within a year or 2 years or 5 years, they're full-fledged diabetics and they're subject to all of the drugs that are used for these folks and all of the complications that diabetes brings on. The reason diabetes is going up is because weight's going up. The majority of American adults are now overweight, and about 35% of them are actually obese. And every year that number keeps increasing despite what all the experts are telling us to do. So diabetes is on the rise. There's over 20 million people with diabetes. And prediabetes, which classifies as a fasting blood sugar over 100 but less than 126, is also on the rise. There's probably 30 or 40 million people with prediabetes, and the majority of them have no idea that that's what's going on in their bodies. So we test for diabetes commonly. We'll test for prediabetes as well. One of the main tests I like to do is something called the hemoglobin A1C. This is a blood test that takes into account an averaging of your blood sugar over the last 2 to 3 months. So it includes your blood sugar fasting, blood sugar after eating, blood sugar during sports, blood sugar when you're sleeping. These are all thrown together in that number. That's what the test is able to tell you. And hemoglobin A1C, greater than 7 is in the diabetic range. Greater than 6 is pre-diabetic, and it should be ideally in the range of 5.5 or even 5.0. But many people, the majority of people that I test have numbers in the range of 5.8, 5.9, 6.0, 6.5. Then we tell them, you're going in the direction of diabetes. We're not going to be giving you a drug for this. We're going to work on this with lifestyle change because diabetes and prediabetes very much respond to lifestyle changes. So you work with taking the diet and moving it into something called low glycemic. This largely relates to something called the Mediterranean diet, which is the most proven nutritional therapy we have in medicine. It takes away the white foods, so it's the breads and the pastas and the pizzas, the white sugars, the cakes, the candies, the cookies. Those things are taken down as much as possible, and we increase the foods that are low glycemic foods. So those are vegetables, low glycemic fruits like strawberries and other berries, raspberries, blueberries. Those are all low glycemic. People can have fish, they can have chicken, they can have eggs, they can have meat. Those are all low glycemic foods. They do not tend to raise the blood sugar. But we push vegetables, we push nuts, seeds, those particular foods, and olive oil, all beneficial in bringing down the blood sugar, and they also help with weight loss. The lower you can get the weight, the lower goes the blood sugar, and many people have had their diabetes reversed by getting their weight down 30 or 40 pounds that they needed to get off of them. Medications, unfortunately, are usually started as a first choice in most practices. So a person comes in with a high blood sugar, and the doctor says, here's a drug, and that's a problem. First of all, the drug effect is only temporary. If the person maintains the same lifestyle, the blood sugar is going to keep rising. So a year or two later, that dosage of drug is no longer effective. The dose has to be raised. Another year or two later, they need a second drug, then a third drug, sometimes a fourth drug, and then they're on insulin. And they're told they need to be on insulin for the rest of their lives. And the same thing with these medications. Patients are told this is what you need to take forever, and that's wrong. It's not correct information. Person comes into us with an elevated blood sugar or with prediabetes. The initial treatment is with the lifestyle change, not with the medication. We do not put people on medication to start with because you can fix them, you can reverse the condition with lifestyle changes. We'll put in the exercise, the proper food choices, the right kinds of nutritional supplements because there are a number of them that work to make your insulin function better. Things like alpha-lipoic acid, things like magnesium. Fish oils are also beneficial. All of these things together, and we have a number of supplements for them, will lower the blood sugar. And I've seen people reverse diabetes within a month, and prediabetes go away just as soon. So the person just needs to put in the lifestyle changes. The problem with the drugs, besides the fact that they only work temporarily if they work at all, is that it changes the blood sugar, but it doesn't change anything else that's going along with the diabetes. Most of these folks have high blood pressure, high cholesterol, they're overweight, and they're fatigued. And putting them on those drugs doesn't do anything for any of those other conditions. It's the lifestyle change that affects everything. It'll bring down cholesterol, it'll bring down weight, it'll put you into an exercise condition, and you'll feel better.